Okay, today I'm here with Shamin, and I just want to show you how the position of the pelvis can influence the length of the hamstrings. Okay, so the first thing I'm going to do is see if Shamin's got a neutral pelvis. Most of us don't. Okay, so I put my thumbs on the ASISs. Okay, this is slightly forward, so my thumb, I'm exaggerating, is like that. Okay, so we've got a rotation and an anterior tilt. Okay, I'm going to show you on the table how this will influence the length of the hamstrings. Shamin, if you can line your back, please. Okay, if you look at me, if my pelvis is tilted forward on the right, and please remember the pelvis moves independently, there are two parts to it. So very often you get a forward rotation, the other side will rotate backwards. Okay, they reciprocate. My hamstrings attach onto the ischial tuberosity, so if I go forward like that, my hamstring is lengthened already. Okay, but what can happen when someone lies down? If the pelvis tilts forward like that, the acetabulum tilts forward. When the femur tries to come up, it hits bone. Okay, you may interpret that as a short hamstring, but if you looked at the pelvis and you saw that it is anterior, you'll know that it's not the hamstring, it's the pelvis. So you can test, and often this is what you'll see. So can you lift your left leg as high as you can? Fantastic. Relax. And your right leg. Okay, it's not dramatic, but she's got more movement on the right hand side because the pelvis is tilted back and this one is tilted forward. Okay, so it's probably not a good idea to go and stretch the left hamstring. It's actually longer than the right one. Okay, but the pelvis obviously influences what you're seeing here. Okay, the next thing also that can happen, if the pelvis is posteriorly rotated, that's anterior on the left, it's forward like that, this is posterior, it can affect hip rotation. Okay, so something you may also see, if you rotate someone external, yeah, and internal, very often they'll have good external rotation but not such good internal rotation. Okay, or if you pull their knee up towards their chest, very soon they start to abduct. And all this is, guys, again, if your pelvis tilts like that, there's the bone of the acetabulum. As your femur tries to rotate, it hits the acetabulum. Okay, and you may think, it's the external rotators, they need to be loosened. It's not. It's the position of the pelvis. So the take-home message here is you're looking for asymmetries. If someone is quite similar, left and right, it's fine, it's normal. It's probably the position of the pelvis. Okay? When someone's got huge asymmetries, okay, fantastic hamstring length on the right and that much on the left, it's probably more than a structural abnormality. That's when you start getting into, soft tissue work and muscle patterns. Okay, but when something's small like this, it's normally the position of the pelvis. So remember that anterior tilt, posterior tilt makes a big difference on the legs. Okay, thank you. Thank you, Shamin.